Hi, this is Bianca. We are going to be going over our medication checks for week 4. We are going to begin by pulling up the MAR, pulling up the patient, Jean Simmons, 10/31/66, here for a diagnosis of a headache. She has no known allergies, and Dr. Who has prescribed Tylenol 500 milligrams PO now. We are now going to head over and go to our Pyxis. We are going to look for our medication. Tylenol is going to be in a tablet form. We are now going to do our second medication check for Jean Simmons, 10/31/66, diagnosis of a headache, no known drug allergies, and Dr. Who prescribed Tylenol 500 milligrams PO now. We are going to check the expiration date of the medication, 3/20/39. Once you have completed your second check, we are now going to go ahead and head into the patient's room. We are going to knock on the door, close the curtain for privacy. Hi Jane, my name is Bianca. I'm going to be your nurse here. I'm here to give you the Tylenol for your headache that was prescribed for Dr. Who. I'm going to begin by asking them how their pain level is from a range from 1 to 10. Between the range of 1 to 10, Jane, what's your pain level at right now? If they say an 8, I would ask them if it's the Tylenol, if they want to take it now or in a bit with the rest of the medications. We're going to go ahead and pretend that Jean said she's going to take it now. Okay, Jean, do you have any trouble swallowing? No? Okay, can you take a sip of water for me? Oh, before we give Jean a sip of water, we do our hand hygiene. Okay, now we are going to do our third medication check. It's going to be for, looking at the medication bed or hospital bed. We are going to confirm the name, Jean Simmons, date of birth 10/31/66, here for a diagnosis of a headache. She has no known allergies, and Dr. Who has prescribed 500 milligrams PO now. After reviewing that she has no trouble swallowing, we're going to go ahead and administer the medication. Here's the medication, Jean. Sip of water. We are going to discard the medication garbage in the trash. Hand hygiene. Okay, Jean, do you have any questions for me? If they have no questions, I'm going to let them know I'm going to return between 30 to 45 minutes to see how your pain level is. If it's not helping you, I'm going to go ahead and give the doctor a call. So I'm going to do hand hygiene again. Document that Jean Simmons was given the Tylenol 500 milligrams. And just let them know, here's your call light. If you have any questions or need any help, just give me a call. We are now going to go on to our second patient, who we are going to pull up in the MAR. The name of the patient is John Doe. Date of birth is 8/19/1994. Here for a diagnosis of an allergic reaction. John is allergic to penicillin. Dr. Who has prescribed prednisone 5 milligrams PO daily for 3 days. Okay, so once you review the patient and the medication order, we are going to go ahead and go to the Pyxis. Look up the medication prednisone, which is the form of a tablet. We are going to do our second medication check, and it's going to be for John Doe, 8/19/1994, here for a diagnosis of an allergic reaction. He has an allergy to penicillin, and you always want to make sure you check the expiration date, which is 2, and the year is 2039. Once you have finished checking the medication, we are now going to go ahead and go into our patient's room. We are going to begin by knocking on the door. Close the curtain for privacy. Hi, my name is Bianca. I'm going to be your nurse today. I'm here to give you your medication to help with your allergic reaction. And I'm gonna ask, have you taken the medication we're gonna be giving you is gonna be prednisone, 5 milligrams PO daily for 3 days. That was ordered by your doctor, Dr. Who. Have you taken it before? If they respond no, it's here to help with your allergic reaction, to help prevent the symptoms from hopefully you being itchy, cough, or rash, to help it to stop it from spreading. It's going to be in a form of a tablet. So before we have them, I usually would ask them to take a sip of water. I'm going to do hand hygiene. John, do you mind taking a sip of water from me so I can check to make sure your swallowing is okay? Once you have checked their swallowing, I'm going to do my third medication check. It's going to be for John Doe, date of birth 8/19/1994. Here for an allergic reaction. They have an allergy to penicillin. Dr. Who ordered prednisone, 5 milligrams PO daily for 3 days. Okay, Jane, here's your medication, which is a tablet. We're gonna open it, put it in the medicine cup. Have John drink the pill with some water. Once they have taken the medication, we're gonna go ahead and discard the medication trash into the trash can. Hand hygiene. Okay, John, this should help with your allergic reaction symptoms. If you notice that your throat is getting itchy, you're starting to develop a rash, sweating, please let me know. That way we can see if the medication is helping you or it's not. And I'm going to go ahead and call Dr. Who if your symptoms do not seem to improve. If you have any questions, here's going to be your call light. Please let me know. Those are the main symptoms you want to be looking out for to make sure the prednisone is helping with your allergic reaction. Before you leave the room, you're going to document that John was given his 5 milligrams of prednisone. Hand hygiene. Again, let them know that their call light is right next to them. Our third medication is going to be for Sherbono. We're going to pull them up in the MAR. The name of the patient is going to be Sherbono. Date of birth is 12/25/70. Here for a diagnosis of pain. She has no known allergies, and Dr. Who has prescribed Percocet 5/325 milligrams PO now. We are now going to go ahead and go to the Texas after the first check. And since Dr. Who has prescribed Percocet, with Percocet being a narcotic, we are going to count how many Percocet tablets are in the Pyxis. I counted 2, and I'm going to be pulling 1 out. So you want to document that you counted 2 tablets, but you're removing 1 tablet to give to your patient. So you're going to do your second drug check once you had documented that how many there was and what you took. It's going to be for Sherbono, date of birth 12/25/70. Here for a diagnosis of pain. And the Percocet was ordered at 500/325 milligrams PO now by Dr. Who. And the expiration date is 3 and the year is 2039. Once you had did your second medication check, we are now going to go to our patient's room. We're going to begin by knocking on the door, closing the curtain for privacy. Hi, sure, my name is Bianca, and I'm going to be your nurse today. I'm going to be giving you some pain medication that your doctor has prescribed for you. Do you have any allergies to medication? No allergies? Okay, so we are going to be giving you Percocet. It is a narcotic that is supposed to be helping you with your pain. What's your pain level at right now? Between a range from 1 to 10, a 9. Okay, so it is important that we are going to monitor you extra closely once we give you the medication for the pain to make sure you're not having any interactions with the other medications that you are taking. So I'm going to do some hand hygiene. I'm going to ask Cher if she has any swallowing problems. Cher, would you mind drinking a sip of water for me so I can make sure you're swallowing it okay? Once they have did that, I'm going to go ahead and give her her pain medication, the Percocet, at 5 over 325 milligrams. There you go. Sip of water. Before that, I'm going to do my third medication check by looking at her armband. Charbonneau, 122570, verified diagnosis of pain, and Doctor Who ordered Percocet 5 over 325 milligrams PO now. Once she has taken the medication, I'm going to go ahead and discard the garbage into the trash can. Hand hygiene. Okay, Dean, I just wanted to give you a little bit of more information. With the medication we just gave you, Percocet being a narcotic, we're going to monitor you extra closely and to make sure we don't give you an excess amount of pain medicine. So I'm going to return in about 45 minutes. If it doesn't seem like it's helping you, please let me know. That way I can call your doctor and see what the next steps are for you, because I don't want to over-medicate you and have some bad reactions to your pain med that was prescribed to you. Okay, once they understand the steps, okay, June, if you have any more questions, I'm going to leave your call light right next to you. Ring the light for me if you need any help. And like I said, I'll be back in 45 minutes to check how your pain level is. Hand hygiene. And document that Charbonneau was given her Percocet of 5 over 325 milligrams. Our next patient is going to be Araya Stark. We're going to pull her up in the MIR. Name is going to be Araya Stark. Date of birth is 8/9/2000. Her diagnosis is going to be an altered level of consciousness. She has no known allergies, and Doctor Who has prescribed naloxone hydrochloride at 0.4 milligrams IM stat. So we are going to go ahead and go to our Pyxis. Naloxone is actually provided, it's going to be an IM injection. So we're going to go ahead and naloxone is a liquid. We're going to go ahead and use an alcohol pad. We're going to pop the lid. Before getting an IM injection ready, I'm going to go ahead and put in some gloves for some safety. Opening in the vial here, opening the alcohol light, cleaning the top. I'm going to go ahead and pretend this is a smaller needle to get the prescription dose of 0.4. I'm going to take this head of the safety off the needle. You always want to inject down. And then you're going to go up. You want to aspirate first, and then pour the medication down, making sure there's no bubbles. Okay. So putting safety back on, one-handed. Okay, and we are going to go ahead and pretend that we're screwing the head of the needle back onto the proper needle dose. once you, before prepping the medication, you would actually want to check on the expiration date of the medication. Okay, once you have confirmed the expiration date, and it is 7/20/23, so when the medication is good, then you would prepare the IM injection. Once you have prepared the IM, before preparing IM injection, you're going to do your second medication check. It's going to be Stargaraya, date of birth 8/9/2000, diagnosis, altered level of consciousness, no known drug allergies, and Dr. Who prescribed naloxone hydrochloride at 0.4 milligrams IM stat. Then you would do the steps I had just did for preparing the medication. Once the medication and your second drug check is done, we are now going to go into the patient room. Close the curtain for privacy. Hi, I'm Bianca. I'm going to be your nurse today. I'm here to give you the naloxone hydrochloride, 0.4 milligrams IM stat. And with Araya being here with the altered level of consciousness, it means she might not be conscious. So if she has the guardian here, I'm going to have the guardian help me do her third medication check while checking her armband. It's going to be Stargaraya, date of birth 8/9/2000, diagnosis of altered level of consciousness, and Dr. Who has prescribed naloxone hydrochloride 0.4 milligrams IM stat. Hi Mom, does she have any allergies? No allergies? Okay. You need to do hand hygiene. You're going to put on some gloves. So the medication I'm going to be giving her today is just to kind of help her wake up and reverse the effects of any drugs she might have taken. But in the injection, when she has an altered level of consciousness, they might be swinging their arms around a lot. So you're going to turn her on the side and do the injection on the leg. Hey Mom, would you mind holding her arms for me? Okay. So I'm going to demonstrate up here. I'm going to use a half alcohol wipe to clean Aria's leg. After you had did the third medication check with Mom, and Mom is holding her arms, I'm going to go ahead and open the needle. You're going to go at a 90-degree angle and inject. Glue the one-headed, putting the safety back on the needle. And you're going to go ahead and discard in the sharps container. So with Aria waking up, you want to make sure you have a basket net there. It's very common for them to wake up throwing up. She might be agitated, so you want to let Mom know if she vomits, here's the basket. It's normal for her to be agitated, anxious. Just giving her the heads up of all the symptoms she could possibly be experiencing. You're going to go ahead and remove your gloves. Hand hygiene. So once you see that Aria starting to wake up, you're going to ask her, hi Aria, do you know where you're at? If she's conscious enough, you want to make sure you check their name, their date of birth, and see if you can ask them or if they're able to answer you what medications they took to cause a possible drug overdose. That way we can document that. Once you now check that, you're going to ask Mom if they have any questions. Let her know it is extremely common for her to vomit, be a little agitated, and even be sweating. If she's still not completely conscious, we will repeat the medication in an hour or two, depending on what her doctor thinks is best for her. We're going to do hand hygiene again. Document that Aria Stark was giving her naloxone hydrochloride. We are now going to be